Thanks a lot. Thanks to CSR Box for getting the right kind of people in the same room. And we are very excited to talk about a very exciting aspect of healthcare. And like the last session was also about technology for healthcare, it's an extension to that. And I'm sure many of the people will take the learnings from the last session and then contribute further to this one. Thanks a lot for all the panelists to joining in. We have a diverse set of experience here. We have somebody who has experience in business development and partnerships. We have public health experts. We have a founder of a tech company and something which came out of a garage from IIT Kanpur. So pretty good panel here to discuss a pressing issue. It's the future of drones and future of healthcare. So to start off, what we wanted to do was to have a quick pop quiz with all of you. So you don't have to know the answer, but let's get to know how much the audience knows about what has been happening in the space over the last few years. So here's your first question on the screen. What do you think is the number of deliveries that have happened, the number of drone flights that have successfully delivered medical supplies globally? Rough estimate, anybody, no need of a mic. Anybody who has a number in their mind, if you can tell us. 100, we have 100 in the room. Anyone else? A million, very, very optimistic. Great, so 100 million, what else? 1,000, okay. So here's the answer. 700,000 a big number and 500,000 in Africa. And India has got a lot of work to do to catch up to that number. Almost, you are almost right, sir. And the second question now, what is the longest distance that you think a delivery has happened of a payload which was of medical supplies in India? As in kilometers, the distance that the drone would have covered. 20 kilometers. Any other guesses? 108. Did you Google that? Okay. Anyone else? Great. So this is the number. 50 kilometers. Pretty good, I would say. And the next question is, how many state governments do you think in the last 1 year have adopted some kind of a trial of successful medical deliveries using drones? We have 0, we have 3, anyone else? 5, 8, 10. This guy is Googling the answers. Okay, the answer is a very positive 15 in the last 1 year. And there's a reason for that. There has been a liberalized drone policy which came out in the last year. Then coming to a bit of questions on the healthcare outcomes. I didn't know that I'll be sitting in front of the screen, but let me read out the question for you. What % of all global healths due to venomous snake bites happen in India? People who are dying of snake bites. 70%. Good guess. 70%. Any other guesses? Percentage. 50%. Very close. It is 40%, and almost 50,000 people every year are dying in India because they are not getting an antidote to the venom which got injected due to a snake bite. It's a huge problem to solve, and drone is right there on the money in terms of on-demand service delivery. The last question is, the blood loss contributes to what % of all maternal deaths in during childbirth? How many of the childbirth deaths that happen of mothers, how many of them happen because the blood was not delivered on time, or the right blood group or whatever was required was not delivered on time? Yeah. It's close to 40%. So it's a big number. Almost half of them are not getting blood at the right time. It could be because of cold storage issues, it could be because of logistics issues, but this is the outcome. And these are big problems to solve, and this is where drones play a huge role. So with that, I'll give an overview of what is happening right now. This is a program which we call Medicine from the Sky. Like I said, trials have happened in 15 states, but we are still at that trial stage. One of the last panelists mentioned something called pilotitis, that a lot of pilots happen, but nobody knows what happens after the pilots. Kind of we are moving from that stage to the next stage, and that's why we are here to engage a larger community, especially the CSRs. And all of the panelists will help us go through why we should be doing this and how to take it to the next level. So with that, I'll start with the public health expert in the room first. And sir, if you can highlight a bit of the major use cases that drones could potentially solve in terms of the supply chain issues, the logistics issues, but more from a healthcare outcomes perspective.
Well, thank you, Devansh, for the quizzes. I think it's a means to keep the audience awake. With regard to use cases for drones in healthcare, one of the first use cases that we thought of sometime in 2014, and this is before a lot of people were not even thinking about drones, is how to reach out to each and every person in India. Universal healthcare. I think you would have heard this concept in several places. India is a country where even today, if you'd want to reach out, it would possibly take sometimes even 2-3 days just to kind of go to several villages. In Arunachal Pradesh, you can actually see the villages, but to go there, it will take 2 days because you have a valley or you have, and these are not kind of some odd, what you call, off the line places. Even most states, even today, if it rains, it gets cut off. I'm not talking about Gurgaon, okay, or perhaps Hyderabad or Chennai or Bangalore. Bangalore kind of literally flooded actually. So if you look at just about every state, you have significant portions which are hard to reach. And the government's responsibility is to provide healthcare to everyone. Even the private sector's responsibility is to provide healthcare and make a business out of every year. So the first case here is accessibility. I can't access. Drones potentially could give me universal access, so there is a means to reach out to these people. But if I want to systematically look at each and every service that I'm going to provide, then you start looking at, like, let's say, medicines. Okay? One of the unique differentiator between medical products and other products is their shelf life, and also the fact that they have to be protected because of fragility, because of temperature, because of the chemical nature of several of these products. If you take insulin, it's a particular temperature. If you take vaccine, it's a particular or a different particular temperature. If you take blood, again, it's a different temperature. And if you take products like anti-snake venom, it's again a different temperature, which a much shorter shelf life. So you have a variety of products in healthcare that needs to be protected at different temperatures. And some of them are very expensive, some of them are affordable, but still you will have to maintain this at a particular ecosystem for it to be kind of useful. I'll probably give you an example. Sometime 15 years back, this was in early 2000, Government of India decided that they will actually do a hemoglobin survey as part of the national surveys. Okay? Hemoglobin survey, which we know is very simple, which is take a drop of blood and then you have a dipstick sort of a thing and then you will get a reading. In early 2000, there was only one device where you could do that in a rural or a remote area. And this device was from a Swedish company. I'm not naming the company here. But this device would work only up to a maximum of 25 degrees, which is Swedish summers. And you know what our summer temperatures are, which is 45 outside. But inside a box or inside a van, it's like 50, 60. Okay? So the government actually had to procure a van, an air-conditioned van that cost around 25 to 30 lakhs to use a device that actually cost 50,000 rupees. Okay? And these challenges still persist because this device can actually work better now, but up to 32 to 35 degrees. So you still don't have a device where you can possibly test hemoglobin in a rural area, dusty, hot rural area, and can get these results and probably start the intervention. And if I want to take it and then maybe keep it in a protected environment, if I use the regular supply chain, that's going to be extremely challenging. So if I look at medications, it's a challenge to take it to rural areas. If I look at diagnostics, again, it's a bit of a challenge to take it to rural areas, and this is one way. The other way is I actually have to bring back all the blood to hopefully district headquarters, and the usual distance between them in any district is at least 100 kilometers. 100 kilometers, that takes around 3 to 4 hours, and the shelf life again is 3 to 4 hours. So if there is any delay, the blood is not going to be viable. On the other side, if I ask the patient to go to a healthcare system or a diagnostic, every step I ask the person to go to some other facility, there is a 50% drop. And this is again a challenge. So I have to provide all these facilities at the person's doorstep or the point of need, but I can't do it because I can't get all these products to the point of need. So there is a requirement for medications, there is a requirement for the diagnostics, and then to provide healthcare, I also need assistive devices. Like let's say I identify a person who possibly does not have proper vision. I need to kind of give him spectacles. Again, it's not as if this person is actually going to come to a district headquarters or perhaps maybe walk up to a state headquarters. There was another session where people are saying that there's a requirement for 60 crore spectacles in our country. The only way that I can actually satisfy is by taking all this to the point of need. So if I kind of add up all these things, you see that there is actually a huge need for real-time or near real-time service delivery. And the only way that you can actually do that is by using drones. There's simply no other way in the country of our size, in the country of our ecosystem, that you can actually take all these products at the point of need and deliver them in a meaningful time period in a way that it actually addresses all these requirements. So there is actually a huge need that can only be satisfied by drones. And this is where we need to seriously look at what are the specific requirements that our country actually has. India is a very unique country. India is the only country in this world with 30 official languages. No other country actually has. Even African Union, European Union have much fewer languages. So if I want to use the drone, I need to train people in 30 different languages. Again, language is only the starting point. You have a lot more differences that the government itself is struggling how to even manage. And then there is the climate ecosystem. And then there is the power ecosystem. And then there is the general ecosystem that a lot of these things, even though we claim to work, really does not work. So if you multiply all these things, you come out with a kind of a answer where there's a very small thin line where things actually work in our country. And this is where we'll have to work with new technologies. So to summarize, drones are the only way that you'll be able to reach out to all the people in our country. There are multiple use cases in healthcare, but there is also a need to specialize to make sure that these use cases are actually served. Thank you, Devansh.
Great. Absolutely, sir. We brought out a lot of important points. And as you all can see, this is much more than a project which somebody ran in 3 Idiots. It's got a lot of supply chain complexities. It's got accessibility to be solved, affordability to be solved, and a lot of specialization has to get into it, which is why we need all kinds of experts, including financing experts, CSR experts, who I'm assuming are here in the room where we are going to have a good conversation. All right, so with that, I'll change a bit of a gears and come back to the motivation why the practitioners in this space, which is quite nascent and quite promising, why is it that you got into this space? I'll start with Vikram, who's a founder of a drone company. So what got you excited about this space, first of all, and how do you see your journey so far?
Thank you, Devansh. So when I speak about a journey, why we started, or basically why I got into this particular space, it's a very personal journey, and it takes me to that particular time of childhood, where I lost my own sister, my elder sister, to because of there was no accessibility. I come from a very small village in Rajasthan, and still it is not connected to the roads. Similarly, I lost a couple of relatives from the same small village to snake bite. So that was always at the back of my mind. And when I basically joined IIT Kanpur, got the exposure to the technology that yes, definitely technology can be a mean. And that's where all of the dots got connected. And in 2015, we decided that why don't we make this technology relevant to solve on-ground grassroots problems. And that's where the journey of me and my team started with developing the solutions indigenously out of our garage, out of our laboratory, which can actually solve problems of India and then world. As Dr. Suresh was also mentioning that the device was not working beyond 25 degrees Celsius or 35 degrees Celsius, and we had to bought a different vehicle to enable that kind of a device. That's where we started developing our products which can work in -30 also, and which can work in plus 50-degree and beyond that also, because we will be operating in desert of Rajasthan and we will be operating in the Spiti and Kaja kind of a region as well. We will be operating in a coastal area of Mumbai and we'll be operating in the northern part and northeast part as well in Sikkim. And that's where the journey of developing the technology which solves the on-ground problem in a real sense. And then comes the biggest, you can say, evil in the room, which is the affordability, right? India is very, very price sensitive market. And that's where you have to basically develop the technology, which is economical also. And then comes the, on top of it, the regulation. We started in 2015 when there was no regulation. There was a blanket ban on drones. And we were still focusing on basically enabling this drone delivery as a concept. And from there on till this particular date, when we see that, okay, drones, our Honorable Prime Minister Modi ji and a lot of ministers and CMs are talking about it. And obviously, that's a very, very good side of it. But this journey that we have seen is worth, if at this particular juncture, we are able to scale it, solve the problem at mass level. In this journey, we have been able to do a lot of pilot projects, a lot of on-ground studies. We deployed drones for continuous uses for medical supply and essential supplies as well. Now, we are looking towards taking this journey in a way that how can we actually replicate the examples of Rwanda's, Ghana, US, and India is a big market in that way. We have a lot of problems to solve. As you were mentioning during the quiz that the numbers, every single day 72 women dies because of the PPH. 137 people died due to the snake bite. During the COVID, we lost maybe 20 lakh lives. Every single year we are shortage, we are having a demand of 40 lakh blood units, out of which we are not able to supply the entire. Less than 50% is the supply. But even with that 50% supply, we are wasting 6.5 lakh blood units. And a single blood unit can save up to 3 lives. Almost every single year we are wasting the blood, which can save approximately 18 lakh lives. And that is where the focus needs to be there. I mean, everybody is in this room, comes from a different background. And that's where why the wastage is happening, because again the shelf life is low, distribution is not centralized, and even to the laboratories, extending to the answer, even the laboratory, what we are doing is actually enabling primary healthcare centers and CHCs with all the kind of equipments. We are talking about automation. Automation needs large data, large you can say samples, for example. If I need to put up a automated diagnostic laboratory, which can, let's say, produce every day 80,000, 1 lakh samples, that saves a cost. That becomes very, very cheap. But I can't take that kind of a machinery to every single PHC, CHC, and that is what we are doing as a country, as a corporates, as a laboratories, as a government. And it has to be centralized. And all the samples of the state can brought down to the single particular point. So now we need to take this journey, which you asked, in that direction. And hopefully maybe this session can play a part of catalyst also to ignite these kind of thoughts in audience as well. Thank you.
No, absolutely. Thanks a lot for sharing your journey, Vikram. Very inspiring for all of us, especially for me. So with that, to summarize broadly, what he's saying is that it's complicated, but at the same time, the doors keep on opening if you persist, like he has been persisting since 2015. With that, I'll also bring in Kundan to the conversation. If you can speak a bit about Redwing's mission and your motivation of joining that mission, and how do you see the space as of now?
Thanks, Devansh. So like many Indian startup stories, the story of Redwing also began in a college, right? And 3 engineers from Manipal in Karnataka, seniors, juniors, friends got together and started this company almost 5 years back. And Redwing as a startup enterprise, we completely dedicate our mission to delivering healthcare products in India, of course, for now, and then the plan is to go global, like many other Indian startups. So healthcare delivery has been our sole focus, right? Be it vaccines, diagnostic products, any other drug deliveries. Healthcare has been the core mission with which we exist and serve. If I may actually request the audience, we'd actually like to know how many of you here are from the healthcare domain? If I can request a show of hands, how many of you are from healthcare? Okay, and how many of you are from the CSR side of things? Let's say you're part of CSR teams or funding teams. Fundraising. Okay. Yeah, no, this gives us a perspective on what the audience is. So one thing I'd like to add before I pass on the mic to is, like the questions that Devansh put up, right? How many drone deliveries have happened, right? So for those of you who are thinking in hundreds, you know it's not true. And what's been happening with drone deliveries, like any other new technology in India, is that people are perceiving it to be like science fiction. Yes, it definitely looks cool. You should go check YouTube on all the drone deliveries that have happened in India. But the important thing is that it's starting to become a very important element of our primary healthcare system. If you want to improve primary healthcare, improve preventive healthcare, reach the last mile, right? Technology can only go to a certain extent without a human. At the end of the day, you need to send a medical product, right? You need to carry a sample to do some diagnosis, right? Everything is not digital. There are some things that are still physical over here. So as healthcare practitioners, as healthcare funders, we'll have to start seeing drones not as some science fiction or some utopian technology that is needed, let's say, only in some hill in Arunachal Pradesh, not relevant for, let's say, my state and, let's say, Andhra, Maharashtra, Karnataka, right? That's not the way we need to see it. We need to see it as a very important part of our healthcare mission, right? Yes, some places it adds more value, some places it adds a different type of value, but across the board, right, not just me, be it Vikram and many of the other companies who are working in this space, in our interactions with healthcare departments, secretaries, ministers, what's been emerging is that there's a lack of understanding as to how this technology can help. And I think the pilots that have been happening from last year when India deregulated drone deliveries are playing a major role. And our request even to this audience is that when you go back, start seeing how this can play an important mission in healthcare itself. And not as a technology that might be useful, might not be useful.
Great, you actually touched base on my next question, which was, I know most people will have a couple of questions around whether the technology is mature enough, first of all, and what is the policy landscape like? Are there any regulatory issues, safety issues, etc.? So on the technology maturity side, I think you touched a bit, and we have a couple of case studies also on the slides later on. On the policy landscape, I'll go back again to Vikram because he has struggled with a lot of stakeholder management in his journey so far. So if you can shed some light on why this is the right time to get into technology space, especially for the CSRs who are trying to evaluate this as a new category. Why is this, from a policy standpoint, a good time to get into the space?
So I think in a very crisp manner, policy is already here, technology is already here. Technology can be seen from the pilots that has been happening, you can say, last over more than 1 year, 1.5 years. And since Drone Bharat Mahotsav also, Prime Minister Modi ji is also speaking about it. And when you can say the Prime Minister is speaking that yes, drones is the future and drones are going to solve last mile problems, healthcare problems openly, it means that the government of India, the regulators and the policy makers are in support. And even on the paper, the regulations are now solved. So, for example, if you need to enable drone delivery in certain district or in certain state, there are 3 things basically in policy. First thing is whether the drone is made in India and certified. If that is a yes, so that's done. First component check. Second thing, we are operating basically that drone, right? It has to be either autonomous or operated by a pilot. So if it is a semi-autonomous and operated by a pilot, pilot is certified or not, like a driving license. So for example, your car is from a certified manufacturer. Do you have a driving license? And then you want to, let's say, operate these drones in an airspace. Airspace has been segregated in 3 zones, green, yellow, and red. And there has been, you can say, good amount of blanket approval to operate in green zone. With the ATC coordination and defense coordination, you can fly in yellow zone as well. And even with the companies like Tech Eagle and a few, we have received approvals to fly in red zones as well. So that solves the third bit as well. Now comes the whether we can adopt as a user and is this technology affordable, which is also yes. Now, how to scale is the question. So policy and tech is sold now after an effort of a lot of stakeholders over last 5-6 years, basically.
All right, thanks a lot, Vikram. Summarized it very well. Now, with that, where you ended, how do we enable adoption? It all depends on who is the end user and is he getting the right kind of value at an affordable price. So for that, I think we can bring in Dr. Suresh, where he has been doing needs assessment at the PHC level. And adding, so first of all, what we would like to understand is what were the results of that need assessment that you have been doing over the years? And also, how could that need assessment help a CSR to engage in this kind of a project, let's say in the form of an impact report, or what would be the metrics that a CSR would look at to enable these kind of things on the ground?
Thank you, Devansh. I'll probably add a little bit to what Vikram has been saying. When you say that a policy issue is actually sorted, policy issue is sorted on the drone side, not necessarily on the healthcare side. Because the biggest differentiator between healthcare as a service versus any other service is if you have a new technology today, like let's say you have a new technology for a mobile phone screen, 1 year or possibly even 6 months down the line, it could be actually adopted because there are so many companies who would want to kind of adopt. Not such in healthcare. If you have a working molecule today, it would take 10 to 15 years for it to reach the human being because that's the kind of natural progression of trials and the approval regulatory processes that has to go forward. And a lot of them don't even exist in India. A lot of them basically are only in America, only in Europe, and that's unfortunately the way things are. India is a huge pharmaceutical producer, but sorry to say we have not actually come out with an original molecule in our own country. So we have been reverse engineering and coming out with cheaper version, cheaper generics, but on our own we haven't come because of two reasons. Even if we come, a lot of our companies simply give it away to larger pharmaceutical companies because there is no clear kind of regulatory pathway for it to get approved. So on the drone side, yes, there is a lot of traction with regard to policy, with regard to kind of approvals, with regard to even support from the government. But on the healthcare side, it's still a little bit challenging. There are 15 states who are working with drones in healthcare, but a lot of them are technology demonstrators that are coming from somewhere high up in the government, from Chief Minister's office, or perhaps some kind of an interested minister who is trying to take it up, or an interested civil service person who is actually trying to take it up. And the healthcare department, in most cases, is actually a silent spectator. Hey, something is happening here. Let's kind of go and then see how things are. Yeah, it all sounds interesting, but then how is this going to impact healthcare? And impact healthcare, again, is not an answer that you can actually come up with in a day, perhaps even 2 days, or even a few months. Anything for it to impact healthcare takes 3 years or 5 years. You can go on and claim that, okay, I've saved one patient, I probably saved one person from not dying, but that's technically not impact. You're looking at it from a system perspective, which broadly means I'm looking at a larger population, I'm looking at a system, I'm also looking at a new technology that needs to be integrated into this ecosystem, which means training has to be done, skill development has to be done. And on the other side, I need to have a set of conditions where this new technology is addressing that one. And then over a period of time, people actually build confidence. And then they start looking at it positively. And then there is a larger population who start depending on it. And then you also see that there is actually outcomes that can be attributed to this. So there's a whole set of things that need to be proven, and all these things cannot be actually done in one day. In one of the districts, we went for a very different reason, where the government actually asked us to identify what is the best way to set up a diagnostic chain in this district. We went and took almost 50,000 photographs. As PHFI, with closely working with the government, we could do it. We also geotagged each and every primary healthcare center, around 30 or 35 of them. This is a district of 1.5 million people. There are about 800 villages, we geotagged them also. There are about 250 sub-centers, we geotagged them. We also took photographs of all the OP registers in all the PHCs and also all the government hospitals where every patient were actually kind of recorded. So we have a very clear idea on who all walks into a government health system. What is their signs and symptoms? What is their diagnosis? What was actually used to treat? And then we also identified how much medicines are actually being used by these facilities. So working backwards, we found out that at least you will be needing a fairly long-range, heavy payload drone to kind of address these requirements. If I'm going to use drone as the only means of transportation. It may not, but drone has its own advantages. So broadly, what you are looking at is, number one, there is a very clear and a very precise need for drones in healthcare. Nobody is actually denying it. But how do I kind of fit it into this ecosystem? Now, how do I actually first build a drone that I actually require, the specifications for which we require, and we kind of presented this in 2018 or something. One of the first specifications that we said was the drone has to be vertical takeoff and landing. A lot of drone companies simply fly drone over a healthcare facility and try to drop. It does not work in India. Thankfully, both these companies actually have drones that can take off and land vertically. The second one is modular pedicle payload boxes. Healthcare, as I mentioned, is having a product that has to be stored in different temperatures, and each one has to be stored differently, possibly even transported differently. So you need to have a modular medical payload. And India is a country of 1.3, 1.4 billion people, meaning you are actually looking at maybe tens of kilos or perhaps even hundreds of kilos of payload that is actually required on the other side for at least 1 week of use, or maybe even like 2 weeks of use, so that you'll be able to use the regular healthcare systems. So broadly, this is the needs assessment that we did. On the technology side, there are drones that can fly maybe 72 hours with 30,000 kilogram payload on the military side. On the smaller side, you have drones that can fly 2 kgs, 5 kgs. But we need to come out drones that fit into our ecosystem. When we go and tell the healthcare system, we need to tell them that, hey, there is a drone that can address your entire needs, the entire needs of a PHC, because that's what they want. If you don't going to tell them to say, okay, this is going by truck, this is going by a bicycle, this is going by a drone, and this is going by some other kind of means of transport, these are things that a healthcare system would find it very difficult to handle. So this multitude of solutions for a single endpoint is going to be very challenging. And this is also one of the reasons why we keep talking about pilotitis, because digital health solutions broadly are not very comprehensive today. They are kind of advanced, but as one gentleman said, there are 20 apps on the Asha's phone, or perhaps even 25 apps on the Asha's phone. If one app can actually deliver, the government would be more than happy to adopt. So that's the kind of thought process that we need to have. Do we have a comprehensive drone system that can actually address the requirements of the present healthcare needs? And in some cases, we have made a great start. We need to continue this start, and this is where CSR support has to come in. And as I said, 6 months trial, 1 year trial really does not show healthcare impact. You need to push it to 3 years, you need to push it to 5 years. Not the kind of ideal drone that we are looking at, but at least to sensitize the crowd, sensitize the healthcare system, make them acclimatize to the kind of ideas, make them kind of understand that this is actually a need. And a lot of these states now, especially Kerala, especially kind of northeast states, as soon as it rains, are now reaching out to drone companies and say, hey, can we start running these projects, or can we start running these sorties, because we know drones are the only way that you can actually reach out to these people. But this has to kind of not just be after rain effect, but rather more of a throughout the year effect. And that will happen when people get sensitized, and this is where CSR support is required perhaps for the next 3 years, next 5 years, to run multiple projects across the country, to get the healthcare system sensitized, to generate all the evidence that is actually required to say that there is actually an impact happening in healthcare. And if you take out the support, this impact will not happen, and that is when the government actually steps in. But we also need to use up the time to come out with a drone that addresses the specialized needs of the Indian healthcare system. And if we can bring all these three things together, I think we would see a future where we'd only see drones flying into the PHCs, probably delivering whatever you'd want, and probably people getting universal primary healthcare or universal healthcare at their doorstep. And all these things are possible only with drones. Thank you.
Great. Thanks a lot, sir. That brings a lot of ground insights of what actually happens in a PHC. With that, we'll actually zoom out a bit and take a look at a global example. World Economic Forum tries to bring in global knowledge and see how public-private partnerships can adopt those kind of things. It might not work, but it definitely serves the purpose of inspiration. So we have an example in Africa, like we mentioned that most of these deliveries are happening in Africa. You can see that the largest automated on-demand medical delivery service is there in Africa. And it's an established model. It has developed over many years. and it is doing its job in a very automated way as a holistic logistics system. It's not a standalone drone solution. It takes care of all the logistics problems that are there on the ground. So for example, in Rwanda, some of the numbers I'll just read out. In Rwanda, the drone systems resulted in a 67% reduction in blood wastage based on a third-party evaluation. That's a huge number. Like we said, that it impacts maternal mortality, and if that can happen in India, the same kind of things might not work, but at least we have some hope that this does work somewhere. And also we have 99% reduction in delivery carbon emissions. So that is another major thing which logistics is facing. And the future is net zero. If we are moving towards that, drones, especially electric drones, that is still a way ahead in the future, but still that can even further reduce carbon emissions. Last bit was 94, yeah, it's the same. Electric vehicles, even compared to electric vehicles, trucks, logistics companies, we can still save 94% carbon emissions if we use a drone. So this is a global example for some inspiration. Now given this as a background, I like to open up how can India reach this scale. It might take a few years, it might take 5 years, maybe more than that. But we are in the long game, especially Vikram is. So I'll hand over to Vikram for now. I'll take comments from everyone. What do they have to say about this global success story? How realistic is it? How much of it is possible? But if we have to get there, how do we get there? Vikram.
So I think before I jump to that particular question, everybody who are being part of as in this ecosystem as a stakeholder needs to take proactive steps rather than reactive steps. As Dr. Suresh was also saying that when the disaster is there or the rain is there, then everybody is asking that, okay, can you send 10 drones or 20 drones and can you deploy them now? Versus assessing those needs, because it's happening every year in certain states where the floods are happening or earthquakes are happening. And eventually, that kind of a step needs to be taken, and that's where the CSR or the foundations or the companies like us comes and then start developing these solutions. But when we take example of global companies, how did they achieve the scale and achieve these numbers basically? Who helped them from 0 to 1, 1 to 10, 10 to 100, and then 100 to maybe a million? So we have already done 0 to 1 now, and we are already doing 1 to 10 also, with certain government support, certain private equity support and all. But literally that catalyst needs to be brought in, which is like a CSR funding, which can be a foundations funding, which gave their support of couple of millions to start with, to actually cover a one hub and a spoke model. Like you take a 100-kilometer radius, have a centralized supply chain, and have a centralized diagnostic laboratory, and then distribute everything from there to the entire radius of 100 kilometer and bring all the samples to that particular one facility. And if that kind of project is supported by the CSR funding or the foundations, and that is the kind of a step we need to take in India as well. If we take certain kind of a learning from the global projects. And just to answer and touch upon Dr. Suresh's point that saving one life is impact or not, one life that we lost actually impacted in bringing me or my team together and developing these kind of solutions, leading the way. On a positive side, saving one life is also the impact and can actually play a catalyst role and eventually start everybody to focus in this particular area that yes, drones can actually really create that impact. But we need to start somewhere, and that one will become 10 and 10 will become million. And that's where I think we have to look at the catalyst's role. Thank you.
Great. Thanks, Vikram. Putting the same question across to you as well, Kundan. How do we get to this kind of a number? And also, if you can add on some experience in Arunachal and how you have worked with USAID, and how could somebody who's looking to finance such a project in order to achieve this kind of a scale, what could be a roadmap for that financier?
Sure. So in terms of scaling, I would say two things are very important. Okay, I'll put it like this. Let's say three things are very important. First is the whole part about educating stakeholders itself, right? I know I'm repeating this point, but I'm doing that because it's like very important. Educating our stakeholders that this solution has to become an integral part of healthcare system is the first step to even scaling it up, right? Finance comes later. First, governments and public health systems should be accepting this, right? To pilot these solutions, to scale these up. Let's take any technology for that matter, right? For those of you who've been in the system, you know that before 2003, 4, there was hardly something called a 108 service, right? Till Satyam Foundation actually started that in Hyderabad, right? Today you have 108 all over the country. There is, can we say that there is no need for emergency care before? Emergency care was always there, right? Even in the 1950s it was there, 1990s it was there. But technology shaped up when somebody started taking that step, right? Today if you go to many, I would say, good district hospitals, in states that are well funded in healthcare, you will see machines like MRI, CTs, even in district hospitals. That is not the case 10, 15 years back, right? So many of these technologies that people felt were only for the privileged, only for the rich, are becoming mainstream for a lot of the population. So similarly, convincing governments that drones are also a very important part of the system, because then they'll play a massive impact in terms of helping rural population is the first step. Then the second step is financing, right? When I say financing, just like any new technology, someone has to play the catalyst role, right? And the way we have been able to do that is through blended finance. So in fact, the Arunachal project that Devansh is referring to, when you have the time, you can actually Google about it, right? So Arunachal Pradesh, we went live with a drone network in the district of East Kameng. That is under the Medicines from the Sky program of the World Economic Forum. And that pilot is being supported by USAID. And so we need more such catalyst programs that are happening in the country, because see, governments want proof of impact before they put their money in, right? That's the case with any program, not just drones, right? If you want to build some new type of a building, or lay a new type of a road, or try out a new system, right? They always want to see impact before they spend taxpayers' money, right? This thing also came up in one of the discussions, where as a public sector unit or as the government, the scrutiny is of insanely high levels, right? So they don't want to be seen as spending money that is wasteful. So that is where the role of CSRs, foundation, catalytic funders come in, where they support a program, demonstrate impact, and then it becomes very easier to convince governments to scale it up. Even the African success stories, if you read about it, you will see the hands of UPS Foundation, Gavi, Gates Foundation, a lot of them play, Pfizer Foundation, a lot of them have played a very pivotal role in seeing the technology scale like this. Today in countries like Rwanda and Ghana, not hundreds, thousands of healthcare facilities are being served by drones. That is the scale at which these programs have shaped up over the last 5 years, right? So having that blended catalytic finance, and where foreign foundations have already started supporting us, like orgs like USAID. But in India, there is a lot of CSR funding that goes into healthcare innovation, right? And I think a part of that funding, if that can be carved out for drones, that will help support scaling up of this ecosystem. And the third point I'll come to is execution. Just like any technology, ideas are great, but it finally comes down to execution, right? So supporting the right implementers is also a very important thing, right? What you don't want is supporting a bad implementer and the project goes bad and people lose trust in that. So making sure that you do a lot of diligence and you back the right implementer is also a very important thing, to make sure that the right companies are backed to scale these solutions up and take them to a national scale.
Great. Thanks a lot.